Radiation therapy has saved countless lives in the past decade alone, and in the past year, it is approximated that upwards of 3 million lives were saved by radiation therapy. This data was collected in a study performed by Bryant et al. I'll be going over 3 points of radiation therapy, the first being how it can be used to treat all forms of cancer. Then I'll go over the 2 methods of using radiation therapy, those being external beam radiation and brachytherapy, or internal radiation. Then I'll finish by going over the physiology of how radiation causes cancer cells to die. So radiation therapy can be used to treat all forms of cancer, unlike chemotherapy, which cannot be used to treat brain cancer, because chemotherapeutic agents cannot cross the blood-brain barrier. This makes radiation therapy the primary treatment for brain cancer. However, radiation must be used in low doses when treating brain tissue because brain cells do not regenerate like all the other cells in our body. To counteract this, radiation therapy is often used with a supplementary treatment of something called Optune, which is something that exposes your brain tissue to low voltage electromagnetic fields that help cause cell death in a similar fashion to radiotherapy. The first form of radiotherapy is external beam radiation, and this involves shooting a beam of radiation completely through a patient's body. And at a glance, you'd think that would cause a lot of damage to healthy cells, not only the cancerous cells. And in reality, most beams of radiation are very low doses, and these doses are compounded for a tumor by shooting beams from all around the patient and having them intersect at one spot, that spot being wherever the cancer is. The second method is brachytherapy, or internal therapy. This involves imbuing an actual object with radioactive material and placing it at the site of where the tumor is. This is used to treat more aggressive forms of cervical cancer and prostate cancer because it allows those sites of cancer cells to be exposed to higher levels of radiation while still protecting the surrounding cells. This method of treatment is quantified in a study performed by Holschneider et al. The physiology behind radiotherapy I find extremely interesting. Radiation causes something called free radicals to be formed in cells, and free radicals, or reactive oxygen species, are molecules that contain an oxygen atom that has been given an extra pair of electrons. This makes them extremely reactive in the cell. When a reactive oxygen species or free radical comes across DNA in the cell, it's so reactive that it rips one of the nucleotide bases off of the DNA. And if you imagine that double helix, one of the bases just gets ripped out and that DNA is now broken. So when the cell tries to replicate its DNA, it will not be able to, and that will cause the cell to commit something called apoptosis, which is programmed cell death. And this is how cancer cells are killed, because cancer cells proliferate at a much higher rate than normal cells. So if you attack their reproductive mechanisms, you're much more likely to kill off those cancer cells. In healthy people, reactive oxygen species can be extremely detrimental to health or even cause cancer. That is why healthy people supplement their diets with something called antioxidants, because a reactive oxygen species is just a substance that has been highly oxidized. So antioxidants will go into those cells and reduce them, causing them to be much less reactive. This phenomenon is quantified in a study performed by Stone et al. Radiation therapy takes a lot of time to show effects, whether they be positive or negative. This is because it takes a lot of time for reactive oxygen species to form, then react with DNA, and then for the cell to go through its cell cycle and realize that its DNA has been damaged. That is why in radiation therapy, often treatments, good or bad, do not peak until about 1 month after treatments have subsided. Radiation therapy is very taxing on patients. A lot of the time they will just be fatigued, and if a patient is going through brain cancer and is being treated with radiotherapy, that patient is unable to drive because seizures are low rate, they are a potential side effect. That is why social support is so important for cancer patients going through radiotherapy. In conclusion, radiotherapy has saved the lives of just an uncountable number of people, and without it, people would continue to be lost to this day. It is used to treat all forms of cancer using external beam therapy and internal therapy, or brachytherapy, and it causes cell death in cancer cells by creating something called free radicals, which destroy the DNA in the cell, causing it to commit something called apoptosis, or programmed cell death.